No one's watching this closer than the doctors in America that serve patients every day. And Dr. Mark Siegel is professor of medicine at New York University Langone Medical Center, part of our medical A team here at Fox. How you doing, Doc? And good morning
to see you, Bill.
To you. Let's take it one at a time, okay? 3 areas to cover. Trump says insurance for everybody, but not single payer. What does that mean to you as you hear that?
What he really, I think, is trying to talk about is that Obamacare is not working in the doctor's office, which is why 2 surveys of physicians this year, 3% gave it an A grade, Bill. 3%. Most give it a C. Why? Because of all the regulation, because a patient comes into the doctor's office and they say, I'm ready, and the doctor says, well, wait, we got that $6,000 deductible to talk about, and the patient's not expecting it. I think what President-elect Trump is talking about is a scaled-down catastrophic insurance that's not as regulated, that's complemented with health savings accounts that are fully tax deductible, that premiums are tax deductible. You start with a catastrophic insurance that everybody needs. Make sure everybody has that. Keep your Medicaid extensions in there. Switch them, as Dr. Price says, to block grants so that they're cheaper.
Price, yep.
So that they're cheaper. So again, Medicaid expansion is in place, but insurance, instead of Obamacare, you see a more scaled-down insurance that fits more people.
Okay. Topic number 2, he's going after insurance companies, suggesting in that Washington Post interview. What does that mean? Going after insurance companies in what sense?
Again, because insurance companies are benefiting from President Obama's 10 essential benefit package. They love that, right? Everything is covered. Maternity care is covered. Sexually transmitted diseases are covered, Bill, only if you're a woman, though, and the treatment is not covered. There's so much irrationality with the 10 essential benefits that I think going back to covering emergency room visits, hospitalizations, and then going from there will allow, it's great to say maternity care should be covered, right, Bill? But how much maternity care should be covered? And how many times should it be covered? And should it be covered for a year? So this kind of thing needs to be scaled back.
Meaning you have to buy it whether you need it or not. And there's been a lot of criticism.
Exactly. Dr. Price says let it go on in the doctor's office with the doctor and patient negotiating it.
Point number 3, negotiate drug prices. So Mr. Trump is suggesting that he'll put pressure on these drug companies to lower their prices or do a deal where you can get a better price. What is the effect of that on the system? How would it make things better?
I actually like to attach that to John Roberts' excellent report that he just had, which is like this. Medicaid, we already have the best price in a state. So if you go to the state, you don't get whatever drug you want. You get a formulary and you get the cheapest, and it's negotiated. If we add negotiation to Medicare, 78 million baby boomers, Bill, we're going to drive Medicare Part D prices down because they're not going to be able to give us these. Doctors and patients aren't even aware of how expensive this is. When I give an intravenous treatment that's covered under Medicare, it's thousands and thousands of dollars. Goes right into the drug company pocket. No one is negotiating it. By the way, this is not popular among conservatives, which shows you we're talking about outside-the-box thinking. I'm in favor of this. Medicare negotiating prices.
We're still waiting.
I think it's a great idea by President-elect Trump.
On the hearing schedule for Tom Price, but when that happens, it's something we'll carry live, and we'll see what ideas they have then.
He's going to be a very big part of this, Bill.
Thank you, Mark. Dr. Mark Siegel here. Thank you.
Thanks.
Shannon.